And in Africa, basic healthcare systems in the affected countries are crumbling under the pressure from Ebola. The United Nations Children's Fund is ramping up its fight beyond the front lines. CCTV's Liling reports from New York on UNICEF's ideas for dealing with the outbreak.
As more people die from the Ebola epidemic now plaguing 5 West African nations, UNICEF has declared that basic healthcare cannot be the next casualty. Fears over Ebola have kept frightened doctors and nurses away from work and prevented the ill from seeking help at medical centers. Dr. Heather Papowitz, emergency health advisor at UNICEF, says this has disrupted healthcare systems in the affected countries, and it's threatening to dramatically raise the number of illnesses and deaths from common diseases.
These are countries that have very weak health systems. And children are at risk of dying of regular diseases, malaria, diarrhea, pneumonia, newborn causes. Women can't get access to health services to deliver babies. So this is what children and women are dying of on a continuous basis.
In response, UNICEF has ramped up emergency relief, airlifting over the weekend 68 metric tons of health and emergency supplies to the Liberian capital of Monrovia, including 27 tons of chlorine, 450,000 pairs of latex gloves, IV fluid, oral rehydration salts, and ready-to-use therapeutic food. Some of the supplies will go to health workers fighting Ebola on the front lines, and others will be distributed to health facilities nationwide suffering a shortage in basic healthcare materials. Another flight is expected Tuesday. The organization and its partners have also delivered 2 million bars of soap and more than 600,000 bottles of chlorine to households, health centers, and schools in Liberia and Guinea.
Well, we have a short-term effort to stop the disease, but the long-term effort is really building up these health systems and getting them back to functioning, but even better. So in the future, when there are other outbreaks of Ebola or cholera or measles or malaria, some of the issues they deal with there, that they'll be better equipped to manage that in the future.
And being better equipped involves more than just assisting governments in their frontline fight and rebuilding weakened health systems. International organizations are also enlisting the public by empowering it to overcome Ebola fears through social mobilization. That means providing reliable information to frightened communities to dispel myths and correct misconceptions so they can work with authorities to fight the outbreak now and in the future. The key message: Ebola is a disease that can be contained. Liling, CCTV, New York.